Katie Sutton, welcome to the Doggone Positive Way. How are you doing, Katie?
Good, except my name is Katie Strausser.
Holy shit.
Really?
When did that happen?
About 3 years ago.
How come I didn't know about that shit? So, Katie Strausser, welcome to the Doggone Positive Way.
Hi there.
Podcast. Hi, how are you?
Good.
Hilarious. All right, Katie. So, you are a vet tech.
Yeah.
And there's a lot that goes into your job. There's so many layers to it I'm talking like from a client's point of view. Like when we go in and we see all the things that you guys do, it's like, whoa, that's a lot of stuff. But I know that sometimes people are like, they're a vet assistant or vet tech assistant, or they're not a vet tech, or they are a vet tech, but they haven't gone through official training, or they've had on the job training and all that type of stuff. Can we talk a little bit about your experience and what you did to become a vet tech?
Sure. Yeah. So there's kind of like, not necessarily misunderstanding, but a lot of like nomenclature and different phrases people use. But I chose to go to school. So I had an prereqs done, and then it's a 2-year degree, an AS that you come out with for veterinary technology. It is very similar to human nursing school. It's a 2-year program. When we get out, we take national testing boards that would then credential us to be what is either classified as certified, registered, or licensed veterinary technicians. And it's really just dependent on the state and what they recognize. They're all the exact same thing, but it does mean that we all pass those boards. We have the education behind us, and we have the credentials that we did that.
Okay. Can you just real quick, if you're licensed here in Florida, can you go to Georgia and practice, or is it state by state by state?
It is mostly state by state, but it gets really gray, unfortunately, because most states do not require you to have any kind of certification or credentials. So here in Florida, we are recognized as certified veterinary technicians. However, there are no laws that require us to go to school, or in our state that require an education to do what we do. So like you mentioned, you could be on the job trained. So anybody from, off the street, anyone that wants to could go into a veterinary practice, be trained by them, and do pretty much the same tasks that I can do without having the education behind it. Certain states, there's a handful of them at this point, do require usually licensing at that point, and they have set laws that will say, okay, you have to be a licensed veterinary technician to do certain things, which might be like monitoring anesthesia, administering vaccines, and other things like that are higher level. But the majority of the states out there actually don't require it. So me being a certified vet tech, I could pretty much go to any state and practice and do what I do. But if I wanted to do some of the higher hands-on skills, I would just have to provide them with my education, my certification from passing the boards. And then if their state requires it, sometimes there's a small exam to cover what legally they let you do and don't let you do. But overall, the big picture of it is you don't have to have that education and schooling, and don't have to pass the boards, and you could be trained on the job.
When you say license or certification, those are interchangeable terms?
So certification is being that we pass the boards. Credentials. We have credentials because we pass the boards. But yes, certification versus license versus registered are all interchangeable, and it's just a matter of where state wants to call it. So like, for example, like
terminology.
New York State is like one of the most strict. They license there, and they have a lot of laws as far as what veterinary technicians can and can't do, and what on-the-job trained can and can't do. So they're very strict there about it, and they license them. But if I went there, my education and my boards would still pass. I just may have to take their state exam and then just show them proof of all of my credentials.
Okay. All right. So, because I mean, as far as Florida is concerned, it almost seems like if you don't, if you, I could just go in and I could do your job and get trained OT, right? On the job training, right?
Yes.
And they can teach me how to do blood draws, right?
Yep.
Give vaccines. I mean, I've done stuff to my dogs at home. Hi,
Yeah.
kitty ass. The cats always do that. They're all like hightail walking by the camera. But it's like, however, yes, somebody can show you, but I feel like for me as a client, I'm like, okay, they taught you this on the job, but shouldn't that be part of your, like, if you're a doctor, you're going to, school, you have a residency, and then you have to do an internship. So, like, did you have to do an internship as part of your schooling? Because it seems like if it's an on the job training, you're missing a whole piece of a foundation.
Yeah. So, yes, as part of our schooling, we had to do so many clinical hours. So we had to go volunteer, follow, shadow. Some of them were paid jobs you could do it at. It doesn't, but you had to spend so many hours in the clinic. And any veterinary technology program throughout our country is going to require that. Each individual program, kind of like school, it is college, might organize it differently or have it laid out different way, but they're all going to require it because the standard actually to be recognized comes from the AVMA, the American Veterinary Medical Association. So they do say you have to have this many hours, you have to do this many things in the clinic, basically like an internship. So yes, we had those requirements to get through school, pass it, and even qualify to then take those boards. Excellent.
So, so I'm sure there's just many people who are out there that have on the job training they're great people and all that. But I want to know, when you're laying that foundation through school, like, what's the difference if you're a new person, you just are like, okay, I'm going to start, and a triage situation comes in, maybe a dog or a cat needs some kind of surgery. How is school going to prepare you that better? Be more well equipped, I guess, basically.
Yeah.
So, all right. So let's talk about that again. So we were talking about, like, how you're certified. You went to school. You went to 2 years of school. You have a degree. You have a certification. But also in Florida, you can also do on the job training, and like in some other states also, that there aren't requirements for any kind of certification or particular like licensure or anything. That pretty much anyone, if you have that interest and a veterinarian's office is ready to hire you or wants to hire you, they're like, come on in.
Yep.
And you can do that. And then what you were saying, I was asking you, well, like, what's the difference? And you were talking about the specifics. So let's go into that again. So we don't have the little sound thing.
Yeah.
We can do it. Yeah.
Yeah. So I mean,
important.
What I was saying is that basically, I've been in the field for quite a while, and I've met some very, very talented, knowledgeable technicians that were on the job trained, and their skill set can be really good. They can understand the tasks required of them, which might be placing IV catheters, drawing blood, those types of things. But by going to school, what we really get is the understanding and the reasoning of why, where on the job trained they may not be told those things or have the time to really like delve into it. So, you know, they may be giving a medication or doing a certain test, but they don't really know the reasoning behind it or the in-depth, you know, theory that we got in school as far as what this illness might be, why we're running some testings. We also have like a full course in like terminology and math. So we're learning all of that medical side of it. Where I can, you know, calculate my drug doses, draw them up, administer them, understand how and why they're getting it. And somebody that's on the job trained may just be, you know, handed that medication and told to give it, and they don't really ever get the training as to what they're doing, why, or can't even, you know, do that calculation themselves. And it comes down to, you know, what their trainers want to teach them and how interested they are. But they could make it working years in the field without ever doing that and understanding it and still having that job where the students or the people that went to school for it are going to have that like background to our knowledge.
Yeah, you're already going to have it. You're not going to have to learn it on the job, and you're going to understand the why of it, and how to figure out the dosage instead of being like, hey, just give them whatever 2 mLs or whatever it is you give them, you know. For, you know, and it's good. I mean, for me, for learning, it's nice to understand the why you're doing it because it makes sense. It makes it make sense. And now, do you
I just have to check on this dog that pulled something off the counter. Hang on one
second. Oh yeah, I heard a crash. Okay, go check it. This is real life, people. Katie has, I believe, a lab, and we just heard that crash. Let's see. When she comes back, we'll find out what the puppy did and how old he is and everything.
Yeah. Okay. Sorry.
Okay. All right. No, let's talk about that. Wait, we're segueing. This is the beauty of the show. We're going to segue. I heard the crash and I saw you look. Yeah. And I'm like, oh, maybe like somebody walked in or whatever. And you're like, keep looking. And you're like, oh my God, you look a little concerned. What did it get?
I have like a little like egg cooker that was on the counter that I just unplugged, and my 1-year-old lab puppy just sniffed it out and pulled it right off.
Yeah, I said puppy, and I said, let's see how old it is.
Yeah.
But
Also,
lab.
how do they know like the minute you're doing something else? Because overall, pretty well trained, but she knew I'm preoccupied with something, and she's just gonna go ahead and scope out what's on the counter.
Yeah, because they're smart and they're opportunists, Katie.
Yep.
They're always survival. Ooh, can I get that? Nobody's here. Nobody's gonna know.
And just when you think they like turned a corner, like, okay, you're an adult now. Nope.
No, they slide all the way down the hill. I totally Tony lost his command of going in the crate for 2 days.
Just lost it
yesterday. Yeah. I'm like, what the fuck?
Yeah.
I'm like, why is this happening?
Yeah.
I called Jasmine. I said, I need to call. I'm a trainer. And I just told one of my Susie, I said, Susie, I have to go because I have to call another trainer about my dog. And she cracked up laughing. I was like, I'm doing something wrong. There's something wrong. I'm too close to it. No, I got it back with him. She made a couple of suggestions. I'm like, yes, okay, good. Yes, okay.
They're also different. So like I can't base like anything she does off my last one or the ones I have now because they're all so different.
100% different. Totally different. Same breed, totally different. Doesn't matter. Just like us, different personalities.
I have no idea where she is right now. Olive.
She's like, I'm getting something else.
Yeah, I'll be right back.
Get her a Kong, Katie. We're going to do some Kong stuffing. 1-year-old lab. Labs are really awesome dogs. And they can get into such trouble. But so can all the puppies. And 1 year old, they're still a puppy, in my opinion. They are not mature enough. They cannot be trusted by themselves.
Oh, right now, she's out there laying on her bed like she never did anything. She's the best dog ever.
Yeah, good girl. She's like, see, I'm good.
Quiet. I'm like, what are you doing?
When they're quiet, it's so scary. What is going on?
She's old enough. I don't make her go in the crate unless I'm not home. But I'm like, usually you're in eyesight, and she's not in the office with me.
Yep. She's like,
okay, sorry about that.
No, this is good. This is real life because this is what I talk to my clients about. This kind of stuff. So, I'm just curious, are you when you go to school, like is there extra if you're like want to be a surgeon or you're a doctor but you want to specialize in
Yeah.
surgery
Yep.
on hands or whatever.
Yeah.
Is there
So yeah,
something like that for like anesthesia, because that's so
there
specific?
Yeah, there is. So they're called veterinary technology specializing, which you can do.
Mhm.
Years ago, there was maybe one or two, which were like anesthesia and emergency and critical care. The last few years, they've been pushing a lot more. So there's also specialty for veterinary technicians in like dentistry and oral surgery, rehabilitation. They're working on some other ones as well. So you can specialize. There is no additional like schooling for it. It's similar to like if a vet or a doctor was going to do like their residency in something.
Mhm.
So you would have to have gone to school. You do have to have that degree like I got,
Okay.
and you have to have your credentials that you passed the board. And so then you can specialize, and it's mostly amount of hours. So you have to have so many hours in that specific field. You have to have usually like a mentor over you that's a doctor, and you have to have so many case studies. Typically,
Okay.
there's like a paper or two along with that. So it just depends on the specialty, but you can do that. It's just like it might be like 250 hours and 100 cases, and then you have to submit so many reports. And there is a veterinary technology specialty like group that you have to go to each for the individual ones and then meet their requirements.
Okay. So if say you wanted to specialize in dentistry, you maybe would do like an internship with say like a Dr. Peak or somebody
Yep.
like that who is okay.
Are
So
you here?
man, I am, and nothing that's so bizarre. Okay. So we were discussing the differences between like if you wanted to pursue anything that was more specialized, like whether it was dentistry or anesthesia or I'm sure there's because I know there are veterinary specialists that do like internal medicine or oral or like bones, joints, hips,
Yeah. Yep. So yeah, that's available to the veterinary technician as well. Not in as many fields, since we're not actually doing the surgeries or things like that. But
Right.
several of them. I think there's about 6 now of specialties. Some of it being like emergency and critical care, the anesthesia, dentistry, oral surgery. I believe veterinary rehabilitation is now becoming a specialty as well. So yeah,
Mhm.
there's several available to us. But you would in that case, have to do some additional work. You do have to be credentialed, and then you also have to usually put in a good amount of hours in that specialty.
Uh-huh.
Each one requires their own. They have their own kind of board that monitors that. So it's maybe 200, 300 hours in the field, and then several case studies that you're going to have to review and submit yourself. And you usually
Mhm.
have to have a veterinarian that will be like your mentor and like sign off on these things for you as well.
Excellent.